Hello, I am Amna, student of second year. I am here to introduce about the ophthalmic prism, bordered by two plane surfaces which are inclined at a finite angle. The angle between the two surfaces is called the refracting angle or apical angle of the prism. A line bisecting the angle is called the axis of the prism. The opposite surface is called the base of the prism. When prescribing prisms, the orientation is indicated by the position of the base. Base in, base up, base down, base out. A prism consists of two angled refracting surfaces. The simplest form of a prism is two flat surfaces that come together at an angle at the top. The point is called the apex of the prism. The wider bottom of the prism is called the base. Refraction through prism. Light passing through a prism obeys Snell's law at each surface. The ray is deviated towards the base of the prism. This causes objects to be displaced away from the base of the prism towards its apex. The net change in direction of the ray, angle d, is called the angle of deviation. Characteristics of prism. A prism has a thickest edge, the base, and a thinnest edge, the apex. A prism displaces the incident rays towards the base of the prism. Prism orientation. Prism can be oriented in front of the eye using notations: base in, base out, base up, base down. All other base directions require 360 notation. Use of prisms. Diagnostic prisms. Therapeutic prisms. Diagnostic prisms. 1. Assessment of squint and heterophoria. A measurement of angle objectively by prism cover test. B. Measurement of angle subjectively by Maddox rod. C. To assess likelihood of diplopia after proposed squint surgery in adults. D. Measurement of fusional reserve. E4. Diopter prism test. Microtropia. Therapeutic prism. 1. Convergence insufficiency. Commonest therapeutic use of prisms in orthoptics. For building up the fusional reserve of patients with C. base out prisms are using in exercise periods. They are not wore constantly. Edit with Sophic. 2. To relieve diplopia in certain cases of squint, include decompensated heterophorius, small vertical squint, and some paralytic squint with diplopia in the primary position. Prisms are reserved for those patients for whom surgery is not indicated. Prescription of prisms. Generally, when prescribing prisms, the correction is split between the two eyes. The apex of the prism must always be placed towards the direction of deviation of the eye. Apex towards deviation. Prisms in optical instruments. Slit lamp biomicroscope, applanation tonometer, keratometer. So, that's all. Thank you for your attention.